I'd like to introduce Steven Kelder. Steven co-directs the Coordinated Approach to Child Health, or CATCH, and is also co-director of the Michael and Susan Dell Center for Healthy Living, and is the Beth Toby Grossman Distinguished Professor in Spirituality and Healing at the University of Texas School of Public Health.
Thank you all. Thank you for inviting me here today. What I'm going to talk about in just a few minutes it's been an organic process that I've been working in, I've been working in for the last 25 years ago, really ever since I've been in graduate school. I got trained at the University of Minnesota in community health education and in epidemiology, and decided to specialize in child and adolescent health. So I've worked in a number of areas to improve children's health, adolescent health, even young adult health. And I've worked in a program called CATCH. So it's a coordinated approach to child health is what the acronym means. One point I might add is that finding partners is a very good thing. So I started my work with the University of Texas School of Public Health in Houston. Myself and a group of colleagues have been working on designing, we hope, innovative school health or community child health programs and evaluating them. So as I noticed, some of the comments made out in the foyer area had to do with identifying an effective program. So starting with an effective program, we design, we evaluate it, and we work on it. Michael and Susan Dell of the computer company, they live in Austin. They started their company in Austin, Texas. And we requested funding for them to start a center that would continue funding our work in the design and evaluation and creation of evidence-based programs. But they also gave us resources to evaluate other community programs too. So they give a fair bit of money out, and they noticed a lot of their grantees did not have the technical expertise to conduct the evaluation themselves. So we assist their funded programs in doing that. And we also assist in trying to disseminate what has been found. And then lastly, MD Anderson Cancer Center, we're working with them because they become very interested in population health too. So many of you may know MD Anderson is a famous cancer treatment center. They are getting involved in Houston, Texas, but they have a regional and then in some places a national scope for the work that they do in their cancer treatment protocols. But they are becoming interested in child and adolescent health too. So I say that because partnerships, in my career, I've created the Michael and Susan Dell Center, and with MD Anderson support, I've started a new dissemination-only foundation called the CATCH Global Foundation. I'll get to that in a second. That's my secretary's daughter, by the way. We don't have enough money to hire child actors. So I put this up. It's a cover of a report. You can get a slide to the group, ASCD. They are interested in improving learning outcomes in public and, private education, training of children, K through 12. And just recently, last year as a matter of fact, they have put out statements that says that they are adding to their portfolio of things which they think will help achieve the educational objective, which coincide now with school health education. So, if you look at the history of school health education back at the turn of last century, a number of reasons why we have school health, like meals in school or physical education, is to have a ready and able and healthy population of young men, mostly then, for war. So we had problems with World War I, World War II, building recruits in. We also had an excess of food during the 60s when there was food programs and government subsidies and such to farmers, what to do with the food. Well, give it to the kids in the places that need it to have healthy kids. And as the obesity epidemic rose, and I should say, yes, we do have an obesity epidemic, even though there's reports to the contrary occasionally in the newspapers. We still have an obesity epidemic. We have a diabetes epidemic. Now we have a fatty liver disease epidemic with children. So it's not going away. That's the area that I work in and what CATCH does. So this is a milestone, I would say. It's a paradigm shift to a certain extent, and it's just at the beginning. I've talked to a few of you here, and one of the issues that I bump into in working to try and disseminate school health education is that school systems don't see it as their responsibility. 30 years ago when I started this field and I had a new program, the school would say, oh yeah, we want to have that, come bring it. Now you need to pay incentives and really have to play on personal relationships to get things done in school systems. So it's harder and harder to get into schools, and that's one of the obstacles to train our children to know what a calorie is, to know what, all sorts of things in health education. Baseline sets of information to have an informed population is not being taught in our schools, in my opinion, in a thorough and robust and complete way. This group says that it should be, and it should be because there's enough evidence now that healthy children attend school more frequently, therefore the revenues at the district level go up, and then so attendance goes up, and there's more and more research on the relationship between physical fitness and total fitness and academic achievement. So school systems are paying attention. This is a big deal. It's a very good thing. If you're involved in school health, you should look up this ASCD report. And they've made a model. The CDC, since about 1987, had their coordinated school health model, which took schools and broke them into professional sectors. They worked with CDC to create now a whole child, whole community, and whole school model, which the research is now saying the things that happen on the campus when you're training children to understand calories and the right physical activity and weight-bearing physical activities and anti-smoking, inoculation for drinking, all these sorts of things are better supported if the whole campus is involved, and not just in an educational way, but an environmental way. And then if the community becomes involved, then there's a synergistic effect with the efficacy of your programs and the sustainability of your program. So they've understood this and put it into a new model framework. This just came out this summer. So again, I say that this is a highly encouraging thing to break down the barriers to entry for effective programs, evidence-based programs, to be installed in schools, which is what we do. So this is our model for CATCH and the program elements. We work, if you look at the top, with physical education. Well, you can see it. Physical education, we do professional development with PE teachers. Many times it's the PE teachers who are the leaders on campus for all of wellness. And the PE teachers aren't necessarily trained to manage small group meetings with other professionals. So there's an effort in the pre-service education to retrain PE teachers to be community leaders, to be leaders on campus. We do a lot of professional development, not just what to do out in the fields with the kids, but how do you become a leader and manage a local initiative. We work with the Child Nutrition Services people to bring in healthier food. That's become a challenge because of contractual relations. A lot of food is outsourced now in schools rather being produced locally. When you ask a school system about changing the food offerings, what you're really saying is, can I look at your contract and can we modify it, in the next 5 years when it's due? So that's become difficult. Classroom education is getting the teachers to teach. It's challenging now because there's so many new topical areas that there's just not enough time in the day to teach to health education, and schools aren't held accountable for health education. Family education is reaching out to families. That's has its own set of dimensions. Preschool and after school. A lot of public schools are adding at least a 3-year-old and 4-year-old preschool education component. There's many of these, as well as freestanding centers throughout the United States. Physical activity breaks comes with the realization that we now have a quantifiable target to look towards, 60 minutes per day of physical activity. And now I ask schools, how much of that 60 minutes can you deliver school? How much should be delivered by parents? One way to increase it outside of the PE class, of which most kids get maybe 20 minutes of moderate to vigorous physical activity every other day. So we're talking maybe 40 minutes a week of hands-on movement-oriented work in elementary and middle schools, and almost none in high school, by the way, unless you're in athletics, is to do classroom physical activity breaks. I've seen some schools and research now where kids are standing at podiums and desks all day long and walking. So you can do that and you can increase those minutes. 30 seconds, okay. Here's the desired school outcomes. This is from the educational perspective. Academic progress, achievement, and success for students, positive social and emotional development, high attendance, parent and community support. These could be what considered the values of the educational system. I meet with superintendent groups, and that's where I got these ideas from. So if you want your program to be within the value system of the school, you have to orient it towards what the students want and what the staff needs. I make great use of diffusion of innovation. I see in other areas of the program there's a nicer way of saying this is a comic book version of it. When we take our things to scale, we're looking for program champions, just like he's saying. We divide a state up, just like the previous speaker was saying. We look for the champions. We try and train school systems, then try and get them to tell, show, train, or be role models. And I got frustrated because I didn't find an organization that we solely devoted to focusing in on child health in a way that they would assist schools overcome some of the structural barriers. That is, no school staff well, I won't go deeper. It's in the packet, but my time's out. But so I created a foundation. We just got 501c3 status in August, and we're solely devoted to taking evidence-based, school-based programs and then going to disadvantaged communities and raising money for them to make the program sustainable. We try to sustain this through social media because we have very little money for real media, and those are a number of our different sources where you can find our materials, our school-based and otherwise. Thank you.
Thank you.